The modern family. Let us bridge the gap between generations. Let us shape up the modern family. The modern family. Join the discussion and give us your feedback. Live with Hatem Al-Abd Salam and Dr. Wa'il Al-Harasi. The modern family.
Bismillahir Rahmanir Rahim. In the name of Allah, most gracious, most merciful, all praise be to Allah, the Lord of the heavens and the earth, and peace and blessings be upon our beloved Messenger Muhammad sallallahu alaihi wasallam. Dear brothers and sisters, I salute you all with the salutation of the people of paradise. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for joining us on your show, The Modern Family, from me, Hatem Al-Abd Salam and
Wa'il Harasi.
Today we have another extraordinary show about Down syndrome. We have two honorable guests with us today. The theme for today for Down syndrome is that we're going to talk about the relationship between Down syndrome and physiotherapy, and at the same time we have a parent with a child with who is with Down syndrome, and she's going to share with us the experience of raising a child with Down syndrome.
It's going to be more than that. I think there will be more revelations, as we might discover in the next minutes, inshallah, in the next hour. There are very disturbing revelations that we would like the public to know about what is being done, or actually what is not being done to treat Down syndrome, or to even rehabilitate children with Down syndrome, to integrate within our society and to be respected, dignified citizen here. It is something that we had discussed earlier, and not only discussed, but we are actually pretty disgusted about what has been revealed to us. And I think it's the right of everybody to know about this.
Yes.
Yeah.
We'll go ahead with introducing our honorable guest. We have here Mrs. Paru, who is a physiotherapist specialist for 25 years. She's been working for governmental hospitals in Oman, and also worked in the Ministry of Health. Mrs. Paru, good evening.
Good evening.
Nice to have you on the show.
Thank you for having me here.
You're most welcome. And we have also Mrs. Zuwaina Al-Barwani, who is the Deputy Chairperson of Down Syndrome Parent Support Group. Assalamu alaikum, Mrs. Zuwaina. How are you?
Alaikum salam wa rahmatullah. I'm fine, alhamdulillah.
Thank you very much for accepting our invitation for the show. And inshallah, with both of you, we're going to learn a lot, and we're going to establish an understanding and give the benefit to our listeners about Down syndrome and the effect of Down syndrome. So where do we start, Dr. Wa'il, today?
I think, as we promised our listeners last week, is that we would like to talk about physiotherapy. We talked about experiences of two parents last week, Fatma Al-Barwani and Ahmed Al-Azkawi, both with parents at different age groups. Sorry. They talked about the need for physiotherapy, but they talked from a parent point of view. We would like to know from a professional point of view, why do they need Down syndrome, people with Down syndrome, why do they need extra support in physiotherapy?
Down syndrome children, they have this typical disability about low muscle tone, which means that they are not able to move normally like other children, or the development has a delay. And this delay could be depending upon the extent of which the Down syndrome is there in each child. So depending on that, the mobility, the movements, the development of the child is affected, to such an extent that they will have not normal movements, they will not have normal sitting balances, they will not be able to walk at the age of 1 to 1.5 years. So all these are important milestones in the development of a child, for any child, especially with Down syndrome, because we know along with these physical disabilities, they may also have some hearing, some eye problems. Maybe some of them are also born with congenital other defects like heart problems. So we need to be aware of all of these problems that may be there within the Down syndrome child. That will help us with the physiotherapy, and the earlier they are referred to a physiotherapist, the better the care will be.
Is it just good to have it very early? Is it something that is just nice to have, or is it really
And essential.
Critical.
No, I
Is
think
it critical to
it
have
is.
it
It is
per
very
LSD?
critical.
What-
It is very
what is,
critical.
What is the worst case? What could happen
See,
if that care is not given?
in the experience that I would say for the past 25 years being in Oman and seeing so many children with Down syndrome and other kinds of disability, my experience has been that even the parents, when they have the problem of a Down syndrome child, they are not even being explained what is going to happen to the child, or what is going to be the stage of development of the child.
Or what is Down syndrome in the first place?
Yes, yes. So if that is, I would say a proper counseling needs to be done with the parents.
So this is revelation number 1 to anyone who is expecting a child here in Oman to be born in Oman, that please do not expect any care to be given through government hospital, or not even advice to be given on Down syndrome. It's such a shame, and we have had contact with a lot of people who have shared exactly the same stories, and these stories go from 10 years back, maybe even before, until today, that parents give birth to children with Down syndrome. They are told that their children have this disability very casually, not in a proper way that you would break and use. Then following that, what? Absolutely nothing. So there is no counseling. And this, I feel, the government is systematically feeding the social concept that these people are really not important in society. Your child will not be able to integrate, and they're not important at all. Because if the government is thinking that these people are important to society, they would do something about it. But until today, not only that they are not doing anything, but they're not even helping the parents to do anything about their children. Most basically just to let them know in a very respectful, meaningful, dignifying manner that your child has a disability, but we will be there for you. That is not there.
I think the problem, Dr. Weil, is taking the ownership from the Ministry of Health.
Let's not talk about Ministry of Health. Let's talk about
the
doctors who have sworn an oath.
Yeah.
These people have sworn an oath.
But do they know that is part of their role?
These people have received all the respect they needed from the society, from people. And I really would like to listen from any doctor who is listening to us. Please call us. Please say something that we would have a pity on you. We would like people to call us. We would like, because it is really disturbing. So if I get a child with Down syndrome tomorrow, what should I do as an Omani? Leave the country?
Yes.
It's really disturbing.
The thing,
it's a shame.
Dr. Weil, is many hospitals, maybe abroad, not in Oman, they have a counseling team. That team is the one with the ownership to break the news to the parent and counsel them through that period. Now here, maybe in Oman, we don't have, and the role has not been allocated to anyone to do that role, and people are not taking the extra mile to support the parents. If the role is not being appointed to me, it doesn't mean that I don't be proactive. I don't do something about it.
That is
because
true, but there is
today it might happen to me as well. It might happen to you. It might happen to anybody.
But the pediatrician at least should take that role. I mean,
Initially,
pediatrician,
yes.
at least should explain to the parent, not live in a darkness like what we have experienced.
I think it's fair to display now the number of the program. So if we have any doctors around, maybe they have a different say, they can always call us and disagree with us or agree with us. Our number is 24602058, 24602058. Now,
the number again, because maybe there is a doctor who didn't listen to that yet, so we would like the doctor to really listen to the number and call us.
24602058, 24602058.
Sorry, Dr. Ziu, if we are a little bit harsh, but I think the whole medical community is being harsh on our children with Down syndrome, and being harsh on families who are lost. We are in a community where there is a stigma around disability. There is stigma, and people are ashamed of having a child with any type of disability. And when a doctor is shying away from telling you about your child, It is just confirming and reaffirming that what you feel, the feeling of shame, is actually correct.
Okay, we have a caller. Assalamu alaikum.
Alaikum assalam wa rahmatullah.
How are you?
I just have a little question.
Yes.
Because, I have a lot of children here that I know. I'm actually an Indian, just for your information.
Okay.
But however, I have been here in Oman for a long time, and I've seen quite a lot of children actually affected by Down syndrome. And unfortunately, we do not have a setup here that actually is official, that is actually able to train the children and give them the right path, show them the right path, or in fact even advise parents.
That's very true. That's what we are concerned about.
This is something that I am looking at, not just now. I've tried to set up a foundation here in Oman with because one of my brothers actually has a foundation called the Hope Foundation, HOPE, which is actually in Qatar.
Right.
And in India too. So I wanted to try to bring this hope and give hope to the children here in Oman. To give back something here,
Excuse me, sir, but what does this do?
That the government doesn't seem to sort of support in terms of licenses and things like that.
What does this foundation do? What are the main objectives and activities of
The
Hope?
objective is to train to teach and handle and train children and leave them in a situation where they can actually work and mingle with the general population.
So when you say, excuse me, doctor, when you say you handle different activities, in the sense you have all the professionals in one group, in one organization?
Yes. But however, this is not based in Oman. It's obviously based in Qatar right now.
Okay.
But the thing is that unfortunately, my brother also has a Down syndrome child within the family, and he was very committed to this entire relationship, and therefore he actually founded this organization called Hope, HOPE.
Okay.
And but what I'm trying to do is I want to bring and start a company here. Not a company, a school here. To help children here. Because I don't see any committed organization that is fully supported by the government. I don't know.
That is well noted.
Thank
you very much, and that is well noted. And this is not the first experience. There are similar experiences, and I believe there are still some efforts to start a foundation or a society for children with Down syndrome that sister here could tell you about.
Yeah, we have a parent support
there
group,
are,
which is...
I understand that there are the non-government organizations that are doing this.
NGOs.
The point is that it is not supported by the government, and therefore, the information is not generated enough for the people to understand. This is what I
let us hear what Mrs. Zuena has to say about this.
Yeah,
Inshallah.
we have started a parent support group for the Down syndrome, and it's over 10
Madam
years
Zuena,
old.
we have met before, by the way.
Yes, we did.
We have met in PD or also Hamra once before.
Yeah.
For the same case.
Yeah.
But just please go ahead and tell me.
Yeah, this parent support group, we provide all the specialist service for the newly born baby, from the newly born baby until whatever age they reach, whatever support they need. And we provide speech therapist, physiotherapist, sign language teacher, and occupational therapist whenever available to train the children. And we accept any child with Down syndrome. It doesn't matter whether it's Omani or non-Omani.
It's on the 18 November Street, yeah?
Yes.
Okay, so we have met. I know. The point is that there's still nothing constructional that's actually happened.
That's what we are fighting for. That is what we are fighting for. The group has been quite a number has grown up. It's over 200 kids are registered with us, and our papers are already with the Ministry of Social Development. We are waiting for approval of the association. We are working at the moment with under the umbrella of Early Intervention Center, but we are looking forward for association of our own, because the number of children with Down syndrome in Oman is quite high, and we don't see the reason why we shouldn't get association for that.
The cause of it is what I understand. Maybe I'm wrong. I'm not a doctor.
Well, thank you, sir. Thank you, sir, for your call.
The children are not taken care of. The parents are not well informed. I mean, this is what I want to bring in terms of educational information.
Sir, this is our concern here, and also in the association of the parents, and that's why we're doing these shows to educate people, and then also to emphasize on the officials that it has to be done. Like an organization that you're talking about, which is the Hope organization, also can be part of
who would be the person who I can give a official letter to start something like this? I mean a serious.
We want to take your number down. The studio engineer will take your number, and then
he already has my number.
Okay, then we will call you afterwards, and we'll talk to you after the show. Okay.
Inshallah.
Thank you very much for your call.
I mean, let's together do something. I mean, I know I'm not an Omani, but I've been in Oman for 35 years.
It doesn't make a difference, brother, whether you're Omani or not. It doesn't.
I want to do something and give back something for Oman. So, that will be the best thing to do.
Yes, inshallah, we'll call you after the show, and we'll discuss further.
Inshallah. Madam Zuwaina, it's been a pleasure talking to you. Thank you so much again.
Thank you.
Bye-bye.
Bye-bye.
Yes, we're back. Okay, Madam Zuwaina, can you tell us a little bit more about the association?
The group. The group is running under the umbrella of Early Intervention Center, and it's been a struggle since we started that we want our own association. We feel that the number of children with Down syndrome in Oman is quite high. And it shows the number of children up to now, since we started registering here in Muscat, is over 200 kids.
So what has been the challenges, Mrs. Zuwaina?
The challenge is that we've provided our papers to the ministry and get it registered. Until now, we don't know the reason why it's really.
How long back was this done?
Over 6 years back.
And it has been still reviewed or rejected?
It's not rejected.
So it's still reviewed, 6 years.
Yeah.
Please, Ministry, take another 6 years, because our children can wait. And our children really can wait another 12 years. Please take your time to register these. As an Omani, I feel shocked. I feel shocked that not only that the services are not provided, but we are prevented from providing any service. The government does not need to pay anything. All we need is an association, officially recognized association. We will pay from our own pockets.
Basically, Dr. Weil, if you don't get the association officially registered, you can't move, you can't collect donations, you can't do anything.
And this is what I'm saying. It is systematically done to not give these people their dignity. Their children, these children. We have children in not children, they're adults already, in other parts of the country with Down syndrome, who have families, who have careers, and they live absolutely independently. I cannot remember seeing any adult with Down syndrome. I have seen a lot of adults with Down syndrome in Oman, but I can't remember ever to see someone who is totally independent.
With a career or married or
regardless. Career or no career, maybe inherited some money and doesn't need a career, but independent. I haven't seen anyone who is independent. And now thinking about what is the reason behind that, it's systematically done within the government, that they don't need these people. They think they're a liability. and just let them live and die without even being known.
So the first obstacle is that the parents are not informed properly about their child's condition. Secondly, they are not supported in terms of getting the proper therapy, or whether it's
the referral should be very fast. Yeah. As early as possible, they should be referred for physiotherapy and occupational therapy, so that once that is started and the parents get understanding that this therapy is going to be needed for at least first 2 or 3 years of the child, till the child has achieved some development, then once we come to know, maybe they have other issues like hearing, maybe they have other issues like speech. So all of these therapies will have to be incorporated for the development of the child.
And then next, you don't have a specialized governmental centers for Down syndrome.
Let me just ask Zoena one question. The Early Intervention Center is doing an excellent job.
Yeah.
Why is it critical to have an independent Down syndrome association? Just for people to know, why is it important?
It is important because their condition, you can see they can even go to normal schools.
Okay.
Yeah, we need the association to develop early development so that we can help them and go to normal school when they reach a school age.
Okay.
And that school age, when they go to school, they still need support. They cannot cope with a normal school without a support, and that is required from the government to provide that support in the school. I know the government have started classes for special need in normal schools, but those classes are like nothing. I took my child to experience just to know what is available for her. And within,
how old is she?
She is now 12.
She's 12.
At that time I took her, she was about 8, 9. And the experience that there's nothing. I mean, the teachers are special need teachers, but they have no experience how to deal with this kind of children and the mixture of different disability. And my child, instead of developing, he comes home with a bad behavior, beating, spitting, and doing
and she wasn't like that before?
No, at home she doesn't do that. But after going to school, that was happening. And whenever I was asking about her development, I was told, no, she's beating, she's spitting, she doesn't want to do that. And at the end, I said, what is the need of schooling? I better keep her at home and find somewhere else.
Okay, so now I understand the need to get out of the umbrella of the Early Intervention Center is that these children, when they grow up, outside the boundaries of the Early Intervention Center, there is absolutely nothing for them. So the importance of the association is to provide at least facilities for these children after the age of 6, let's say. Let's say from the beginning, they could be with the Early Intervention Center, and then after the age of 6, there is absolutely nothing.
And the objective of our what we are requesting is that to help these children, there will be others who cannot go to normal school. But we have to train them. And also, once they finish the school, any vocational training
they can do.
So they can do. If they can't go on with a degree or something, at least vocational.
Some sort of a vocation can be given to them. Yeah.
Doctor, please tell us. We spoke about these children are different, the muscle tone are different, physically they are different. Take us through what is actually needed to be done from a very early stage to adulthood, adolescence and adulthood.
See, if you see a normal child, when a child is developed.
We have a call.
Let us take this call. Assalamu alaikum.
Alaikum salam.
How are you?
I'm fine, thank you. How are you all there?
Fine, thank you. Thank you for calling.
Thank you. I have a question.
Yes, go ahead.
Not a question, it's a comment actually.
Okay.
I'd just like to echo what Zoena Barwani has just said about the special classes in government schools. I would urge that the Ministry of Education really look into the curriculum of what is happening in those classes.
Do you have any experience with schools? Do you have a child that goes to school?
I tried one of the schools in the Muscat area in one of the classes, and when I approached the teachers, We were not allowed to see the books they were given the children. We were not allowed to know what curriculum they were doing. We were not sure even what they were being taught. The teachers were more into complaining about the facilities and the support that they were not getting from the ministry, and that almost as if it was a burden that they had to teach our kids. This is not how it should be. We should be teaching from what's inside our hearts. They're trained as special needs teachers, and therefore they should be doing it not as a job. Of course, they have to be paid, but we didn't see any development, and as a consequence, I took my son out.
This is very concerning, really, very, very, very alerting, and something has to be done.
Even me, I was promised that I will see a program, weekly program, and I will see on a daily basis what she has done in the school, and there will be assessment in a monthly basis, and until I took my child out, there was nothing. So, I believe ministry, they go and
supervise and inspect.
But I don't know what is the outcome.
Thank you very much for sharing your thoughts with us about schooling. We have concerns medical-wise, we have concerns social-wise, we have concerns now in education as well. It's just...
I think there are a lot of revelations, but we would like to listen more from our doctor here. Let's continue. What's so different, and how can we...
See, if you observe the normal development of a normal child, a child's best growing is from age, the day he is born, he or she is born, till the development of 1 to 2 years. That's the maximum the development takes place. I mean, every way. The child learns to sit, the child learns to roll over, the child learns to crawl, the child learns to walk, the child learns to stand. This not only happens one after the other, it's happening simultaneously. Along with that, the child is looking at you, the child responds to you, the child learns to speak, the child hears different sounds, the child learns from the environment, the child learns from the people, the parents and everything. Now this, because the child, we have a Down syndrome child, that means all of this development is going to be affected. So what my concern has been, in the experience that I have had in Oman, is that we have always seen there is a lack of early referral for physiotherapy and occupational therapy for these kind of children. So if a doctor knows or a pediatrician is aware that this is wrong, this child is born with Down syndrome, the concern would be that the parent should be counseled immediately, guided, okay, the child will need physiotherapy, the child will need occupational therapy. Has the child any speech therapy problems? Does the child have any hearing problems? All of these tests need to be done to identify what are the problems that their child is going to have. And therefore, guide and counsel the parents. Okay, please, you need to start physiotherapy, you need occupational therapy, and it will go on for quite a number of years till your child will show an improvement. But what I have seen is because of the lack of referral, early referral, when a child comes to me, it's like 1 year of the child is lost.
And it is the most important
year. It is the
year.
most important year.
So and what do the parents ask you?
They come and ask me after 1 year, 2 or 3 sessions of physiotherapy, and most of the parents will ask me, when will my child walk? So it's a concern for me, even as a therapist. I know that the most important development year of the child has been lost. From the day the child was born till first year. And the parents tell me, yes, nobody guided us, nobody told us that physiotherapy is needed, that occupational therapy is needed. So if these things get corrected on the medical level, then I feel you already have an early intervention system.
Who should be responsible for the first part of the counseling, for the referral?
See, in Oman, the system has been that only after the doctor refers, the child gets physiotherapy or occupational therapy or speech and language physiotherapy.
So the doctor has to refer?
It should be the doctor or the concerned pediatrician or the concerned gynec doctor. Or there should be a team. Because we cannot get direct referrals. We need the doctor's signature. But the doctor has to refer to physiotherapy. That is the health ministry role. So if that is the case, then I feel the doctors have to bear the responsibility of at least counseling the parents, guiding them. That, okay, we do not have we have a small Down support group here. But we may not have something like a hope organization like the other caller talked about, where everything is provided under one roof. No problem. At least we have these physiotherapy services in most of the major hospitals. Even in all the interior hospitals in Oman has physiotherapy. And most of them have now started getting occupational therapy also. So at least the basic thing can be, dealt with. Can be done. And then as we look into it, we can go in for speech therapy. We can go in for hearing problems as and how it is found out.
Mrs. Peru, another obstacle, another challenge that I wanted to ask you about is about appointments. How soon can a child get an appointment in governmental hospitals?
Yeah, I understand the appointment system is a bit tight. That is again because in this particular area, see, physiotherapy in Oman and especially in the government hospitals, there are different sections that provide. And physiotherapy, as you know, is one specialty that we cater to all the different fields of medicine, be it orthopedic, be it neurological, be it plastic surgery, be it gynec doctors, whatever, all different specialties, sports, we cater to all the different areas of medicine.
Yeah.
So in neurology, where the child will fall into a neurological problem, we have, I would say, not enough staff to give that much of time for the patients,
So we don't have resources.
Allocated
resources
we have allocated resources. I will not say that we do not have at all. We do have. But yes, they may not be up to the par. Like if she says that there are 200 or more people already in the Down support.
In Muscat only.
In Muscat only.
Yes.
So that means that there are many more maybe in the interiors.
Of course.
So if we have the correct numbers and accordingly how, the services need to be provided, then these are trained areas where we need physiotherapists or occupational therapists who are trained in these, giving the therapy for these kind of children. As she knows that what it is, So it is a different kind of therapy. It is not just a patient coming in with back pain or a shoulder pain where you just advise some, some exercises and give some hot pack or a interferential machine and all. No, it doesn't work like that. These are special techniques need to be given to special children so that they can learn.
Give us an example of one of the most critical things that a child with Down syndrome would need and something that you would offer as a physiotherapist. And how would it help the growth of the child?
I would say movement itself. Basic movement of anything. If your child is not moving, all other systems will also not develop. Wouldn't you agree?
Yes.
If you are sitting, say even if you sit, let's say even as a normal adult, if you are lying down in one position, if you lie for even 2 or 3 hours, you need to change the position.
Yeah.
Otherwise your hand or the arm that gets numb.
Is this something that the parents could do? If
at home,
if physiotherapy is not readily accessible, how could a parent
the parent can
help their child?
Yes.
Are there any classes that they could attend?
There are no classes as such, but when the child is taken for physiotherapy, the parent can learn the basic movements or the positions that the child can be kept, or how the turning should be happen, how the sitting should be done to enhance his activities at home.
That's what we provide on our group.
Do you provide classes as well?
And not classes, but the parent and the child will have a chance to see the physiotherapist. The physiotherapist will work with the child and the parent learn from there and take it at home.
Okay, we have a caller. Assalamu alaikum.
Wa alaikum salam.
How are you?
Fine, alhamdulillah. How are you?
Fine, thank you. Who's this?
This is Ahmed Al-Jabri.
Hi, Ahmed. How are you?
Fine, alhamdulillah.
We missed you today.
Thank you very much for the program and the discussion about children with Down syndrome, or I can say anybody who's living with Down syndrome in Oman.
Yes.
I have a comment. I will just keep it as a question for the Minister of Health.
Yes.
Does the ministry providing the statistic? Do they have statistic, especially for the Down syndrome, for the people with Down syndrome in Oman? And do they have any statistic about any other disabilities?
Okay.
And talking about also the physio, as my experience, I have a kid with a Down syndrome. As my experience, you get once and every month a physiotherapy.
Yes.
And that's my question. Go to the doctor the specialist, the physiotherapy you have there. How she can comment on that.
Thank
the
you.
Other thing, Zuena, she's talking about 6 to 7 years in Minister of Social Development about the association.
Yes.
Yeah. The association be there for 7 years. What the minister is waiting to announce or to allow us, Anomanis, who's trying to do their job, as they said, their job. They're supposed to provide all the services for Omanis, and especially for the kid with a special needs and with a Down syndrome. And we trying to put our hands together with the Ministry of Social Development or the whole government, and they don't want even to ask or to show themselves or to just to come and to see, make comments about that association. The minister himself or send somebody to see what we are trying to do, what the service we're providing.
So nothing
Keeping
was...
the file under his table on the hard and his log, it will not help anybody.
So nothing has been communicated to you from the Minister of Social Development regarding the request for opening an association. So it has not been rejected, and there was no any correspondence to your group telling you what is the difficulties.
There is some correspondence. He is asking to give us the parents association. We don't want the parents. We want to help the kids. We don't want to deal with just to consult the parents, but the main concerning is to help the kids.
Yes.
And what's the objection? What is the reason? What is the reason, Brother Ahmed? What is the reason that they don't want to make it for children?
We should be one association with the autism, and that's before announcing. And they got the autism 3 months ago, their own associations, and we're still waiting for 7 years. People waiting in Oman for 7 years. I mean, the kid born and now he already 7. He lost 7 years on his life. Where is the improvement? How he can deal later after 7 years?
Yeah, I would understand if the government are doing their part of this role, and they provide the support, and then they make you wait for all this time for the association. Maybe we can, negotiate with that. But they're not doing their part, and they're not allowing you to do your part, which is something which is not acceptable at all.
Yeah.
Well, I hope the officials from the Ministry of Health are listening to us.
They're listening and put in their concern, because people like this, or people living with any disabilities, they need to be taken care more than what just talking on writing on the newspapers. We're providing. His Majesty, he gives the rights for everybody, for any Omani or anybody who's living in this country.
Yes.
He's trying to provide everything for us.
Yes.
So why other people who are supposed to look at and to do their job, they're very slow, and even they don't acknowledge there is a Down syndrome, children with Down syndrome, a big number rising in Oman every day.
Yeah, you're absolutely right.
A few weeks ago, one of the doctors, and he's a specialist, he wrote a big in the newspaper, in Oman newspaper, and he says the bones with the children born with Down syndrome in Oman, they've been raised from 90 to 120 per year.
SubhanAllah.
That's a shocking number. That's a big percentage of money. If we don't do anything now, in future, a few years, are we going to accept it leaving those people unproductive or they cannot do anything and waiting, supporting for the government of the ministry? And the government, are they ready to support, full support of this kind of disabilities?
Yeah, you're absolutely right, Mr. Ahmed, and I hope the officials from the Ministry of Social Development and the Ministry of Health as well are listening to today's show.
And also, I hope Minister of Education, the same thing. I don't want to
and
talk
Minister of
much about
Education
it because
as well.
it will take a lot of time.
Yes,
that.
yes,
But
you're
also
absolutely
they're the
right.
one also to
Actually, all the officials in Oman, they have to, they have to take the responsibility for this because they work as a team, and facilities is the responsibility for everybody, not for individual ministries only. Thank you very much, Mr. Ahmed.
Thank you for your time.
Thank you very much. Thank you.
Bye.
Yes, we're back to you,
We'll
Mrs.
take a
Barrow.
break.
We'll take a break
and come back to you shortly.
Okay.
The modern family. The modern family. The modern family. The modern family.
Welcome back. Today we have a very hot topic and everybody's excited, which is good, isn't it, Dr. Wael?
It's always good.
That's why we have water here to keep you calm.
It's what would really keep us calm and would make us happy. We urge, we beg the ministry, the government, namely Ministry of Education, Ministry of Health, and Ministry of Social Development.
Yeah.
All together, we need to work in an integrated way to find a way to support children with disability. Because today, disability in people's mind
is a burden.
It's a stigma.
It's the stigma.
Yeah.
Plus, when you think about support, when people think about supporting children with disability, they always think of the physical disability and immediately comes to mind a wheelchair. Yeah, a disabled child needs a wheelchair. That's all they need. Put them in a wheelchair, they'll be happy. Thank you, LNG. Thank you, everybody, for providing wheelchair. That is absolutely fantastic. But we also need teachers. Behaviors as Dr.
Counseling, behavior problems, social integration, mental skills,
that is more
vocational
important
skills,
than a wheelchair.
vocational skills.
Yeah, also we need support from the society, education, educate the society. And what I feel that it should start from the school. The school should teach the children to accept these children with Down syndrome as part of their...
Ms. Zuena, you were telling us before the show of some of the incidents that happened to your child when they were in nursery or in school. Tell us about that experience.
My child actually experienced in the swimming pool. I took my child to the swimming pool. Like any other child, they enjoy swimming. And I wasn't around at that moment when it happened, but one parent went to my housemate and said, "Why do you bring this child here?" And my housemate immediately said, "Why not? Why shouldn't she be there? She's just like any other child enjoying swimming. What's wrong with that?"
True.
And we were saying
what they want is just lock her in, lock her in the house. Don't let her.
No, we were saying, Dr. Wael, that when these sort of actions or reactions happen from people who are not educated, who are from the norm, okay, you would give them the benefit of the doubt that maybe they don't know about Down syndrome and they're not. This is ignorance. But when it comes from someone who is educated and they behave this way, this is not acceptable at all.
It makes you feel worse, that the supposedly educated or well-read people still look down at people with disabilities.
True. Human rights is for everyone.
Exactly. So it's a matter of giving people their own.
And actually,
rights.
even if the child is having, say, Down syndrome, he may be capable in some other way. You never know.
Yeah.
All these children, like autistic children, they have superb capabilities in other areas. So what if they have some physical features which are not as the normal children?
Yeah.
Again and again, we remind people and tell them that all these children did not have the choice of their well-being. This is how Almighty God has created them. And nobody has the choice of
who
how
are we
the-
to discriminate?
Yeah.
Yes.
So we need to give them a fair chance like everybody else.
True.
We need to facilitate for their needs, to cater for their needs, so that they can live with dignity like everybody else on earth.
We're facing a lot of problem even in their schooling, because some of the private schools, they accept them. But again, they get pressure from the ministry and pressure from other parents, because other parents wouldn't like their children to be with the children with special need. Now, with the private schools, they are there for business.
Yes.
So if 1, 2, 3 parents complain, then the only choice is to kick
Remove.
out your child.
Yeah.
So that's the thing we are facing as parents. Yani, we don't get support from the government. Even with our own money, we cannot buy that education.
Miss Zuena, now your child is approaching the teenage category or group. What are the challenges that you're facing at the moment, and what are the facilities available now for your child as she is growing up? Or do you have plans for her?
We have a lot of plans, but how do we achieve them? The doors are closed. My child now, she's in a special center, private center, with special need. She is getting that support. But for me, I would like her to go in a normal school. But where can I put? I don't want her to go in a school 1 year, the next year she cannot be there. That changing of schools is not good for her.
And
so
even-
I prefer to keep her on a center with a special need, rehabilitation center, which she continue, and she loves to go there, because she get all the attention she needs.
Yeah.
What about parents who don't have the capabilities to send their children to these private
special centers,
centers? Or
They end at home or in the whatever facility available within the government, which is not good enough.
Well, actually, today we would have really loved to hear the voice of one of the officials if they called us and at least have a discussion with us or prove us wrong that what we're saying is not true, and work is being done for this category or segment of the community, and there is hope at the end of the tunnel. But again, it's never too late. We can start again now and do something about it. These people deserve their dignity, and they deserve this is their right as citizens and as human beings.
Again, we urge both all ministries, Ministry of Education, Ministry of Health, Social Development, maybe the Diwan, why not? Huh?
Yeah.
Please do something. Please help parents to help their children. Help these little children to grow up and be good citizens like anybody else.
Productive also.
Productive. Let them integrate within society. Give them a chance in life to be proud Omani citizen. Because what we are doing now, we will be questioned in front of Allah. Any person who is sitting there with a high position and authority, we will be questioned. So let us do ourselves proud. When we ask the question, what did you do with your authority? Just give yourself a good answer. Prepare a good answer. Do something today. Do something with your position, with your authority. Please, as an Omani, as a parent, I would like to see that help available to everyone in Oman. My dream is in the next 5-10 years, I would like to see everything available.
We should not be talking about this in the coming 5 years.
Absolutely. Yeah. I would like us to be an example for everybody else. Not only people who are just starting to walk slyly on this route. No, I would like us to see ourselves.
To be pioneers.
Leading.
Yeah. And integrate all these children very well into the community.
Yeah.
With all the support that we can give them.
Yeah. It's a matter of human rights.
And Brother Wa'il, this is contradicting religiously for them, because Almighty Allah tells us that we are created for a purpose. Yeah. And if you're not supporting these children to have a purpose in life. You just want them to be idle. And then this is a total contradiction.
Yeah.
So
absolutely.
they have to do something about it. They have to help these children.
I just hope if anyone in any ministry, it doesn't have to be an official, someone just convey the message, and our lines are open for people to call in. Let us know, let the public know what's going on. We are here every week. So next Tuesday, inshallah, we'll be talking about autism. Another issue, another hot topic. But it is at least something that is being addressed, well addressed by the government. But it doesn't stop us talking about Down syndrome until we get the matter resolved. Yeah?
And we remind our listeners again of our numbers, 24602058. We have a few minutes left of the show. Whoever wants to call to share their experience or to add something to what we have said, then they are most welcome. We leave the final minutes of the program for our guests if they have any last say, any message to convey to the parents. We'll start with you, Mrs. Peru.
It would really be a dream, like Dr. Weil said, to have a proper services for all these special Down syndrome children, where it is integrated very well under one roof, and they all these children have all the issues being tackled under one roof, and they can be well integrated into the society. That would be a great, great dream to see.
Mrs. Zuena?
The most important is the early part of it. I will request Ministry of Health to do their part, because with all this problem with health-wise, if the parent doesn't know anything, how can the parent help the child? So they need to know all the tests which need to be done for the child. If they don't check the hearing, how can the child speak? If there's so many things, if they don't know about the physiotherapist requirement, how can the child develop walking and doing what he is supposed to do? Now, the early intervention is very, very important for them. So that is a key thing to be done by the Ministry of Health.
Mrs. Zuena, for the sake of argument, I'll play the role of Ministry of Social Development. I have already granted you the permission to open up or to register this association. What is the difference that this will do?
The difference is that we will be able to reach those parents. We will have all the support to the parent, because from the beginning we will be there for them. And we give the specialist service they need, all the information and all the development for the child. That's our objective, to start from the beginning until the child get a job to work.
Thank you very much, Mrs. Zuena Al-Barwani, for being here with us today, and thank you very much, Mrs. Peru, for your expertise in the field of physiotherapy and your thoughts regarding children with disability. Dr. Weil, thank you very much for being proactive today, and we hope our listeners have enjoyed today's session and with us
it's
holding
more enjoyment, but I think at least enlightened a little bit on what's going on around us and what we need to do as Omanis, as parents, as citizens.
Dear listeners, thank you very much for tuning in to The Modern Family. See you next week, inshallah, next Tuesday with autism.
Autism, yes.
With autism. Please do call us next week and tell us what you think of autism. Thank you very much again from me, Hatem Al-Absalam.
Wa Al-Harrasi.
Assalamu alaikum.
Thank you.